In this section, we will talk about the function of parasympathetic system in detail. As we have already discussed, the organization of parasympathetic nervous system. Let's zoom the first portion of parasympathetic nervous system. In case of oculomotor or cranial nerve 3, this is preganglionic cholinergic nerve. These are postganglionic cholinergic nerves. This is ganglion ciliare, as name suggests that the effector organ should be the eyes. So it causes activation of sphincter pupil, and it causes contraction of ciliary muscles. In case of facial nerve or cranial nerve 7, this is preganglionic cholinergic nerve. This is postganglionic cholinergic nerve. This is ganglion pterygopalatinum. So it causes activation of lacrimal glands. This is preganglionic cholinergic nerve. This is postganglionic cholinergic nerve. This is ganglion submandibular. It causes activation of submandibular glands. In case of glossopharyngeal nerve or cranial nerve 9, this is preganglionic cholinergic nerve. This is postganglionic cholinergic nerve. This is ganglion opticum. So it causes activation of parotid gland. But what is the result of activation of submandibular and parotid glands? Activation of these glands causes kinin release, then vasodilation, and then secretion of watery saliva. In case of vagus nerve or cranial nerve 10, these are preganglionic cholinergic nerves. These are postganglionic cholinergic nerves. Now let's discuss its effector organs and action on effector organs. On heart, acetylcholine causes slow impulse conduction and decrease heart rate. As parasympathetic system majorly involves in rest or relaxed condition of body. If the effector organ is lungs, so on bronchi, it causes activation of secretion and contraction of musculature. On stomach and intestine, without lower colon and rectum, acetylcholine causes activation of tone, relaxation of sphincter, and activation of secretion. On gallbladder, the effect of acetylcholine is that it causes contraction of gallbladder. When it acts on liver, it causes activation of glycogenesis, which is the formation of glycogen from sugar. On pancreas, its effect is that it causes activation of exocrine secretion. If effector organ is ureter, then it causes contraction of ureter. Now let's discuss the portion of parasympathetic system in sacrum segment of spinal cord. These are preganglionic cholinergic nerves. Then these are postganglionic cholinergic nerves. In case of lower colon and rectum, it causes activation of tone, activation of secretion, and relaxation of sphincter. In case of urinary bladder, it causes contraction of detrusor and relaxation of sphincter. And on genitals, it causes erection through vasodilation in males. This was all about the function of parasympathetic system in detail. In our next section, we will discuss the function of sympathetic nervous system.